So when should you offer baby a feed? Some mums just keep giving the breast or the bottle every time the baby says eh. So watch all the useful tips. The answer is in there for you, and many more cool hacks, okay? Let me clear up questions between breast and bottle, like the do's and the don'ts. So I'm Dr. Chris, MD, helping mums to be happy and raise happy, healthy babies. As a family physician, I've delivered more than 1,000 babies like yours, and I've coached tens of thousands of mums just like you with their newborns. Okay, here's the 9 tips for feeding your baby. Number 1, breast milk only is the ideal feeding for at least the first 6 months. So this means no sugar water or formula. I've experienced that from 1 month on, my twins were less fussy if they got like 10 to 50 milliliters of pure clean water during the day. It flushes out their toxins and rehydrates best. Nobody can give good reason why not, although many people have opinions about it. So try it and see for yourself. There are the age-old, successful, tested and trialed ways of our wise old great-grandmothers that has gone by the wayside, supplanted by sometimes arrogance or ignorance of the medical science. Number 2, wait until breastfeeding is well established, like in 1 month from birth, before giving your baby breast milk in a bottle. Before that, liquids like water or medicine can be carefully and slowly given with a syringe. Okay? Please subscribe and click like if you like the video. I appreciate that. Number 3, mothers can use a breast pump on a break time and refrigerate or freeze the milk for later use as a bottle feeding. So refrigerate breast milk, when you do that, it must be used within 24 hours after pumping. Frozen breast milk is good for several months in the freezer, so then fathers and other family members should be involved in feeding time if it's breast milk that is in a bottle, when that is offered to the baby occasionally. Number 4, offer cow milk based formula with iron as the first choice of formula if you're not able to breastfeed at that moment, or supplement with breastfeed with bottle feed. Number 5, keep your baby on breast milk or baby formula until they are about 1 year old. After this time, you may switch to whole milk. So children under 2 years old should not drink skim milk or low-fat milk, as all the good stuff and nutrients has been separated out and sold additionally as expensive fresh cream on the shelf. Your baby needs all those pieces, so make sure none of this modified milks. Number 6, it's important to follow the formula preparation exactly as directed on the packaging. Using too much water can of course result in pure weight gain because there's not enough substance in the milk. It's also important to use the best quality water you can get, like spring water or filtered water. Plastic bottled water contains microplastic particles like BPA, phthalates, xenoestrogens, and many other harmful and disrupting chemicals, and so does tap water, straight tap water. So in some areas, water must be boiled first, or bottled water may just have to be used if there's nothing else. Avoid fluorinated water until you've at least had a talk with me. Okay, the 7th one, formula bottles. They should never be propped up because it keeps flowing and the baby can choke on it when it's dozing off while drinking, which of course they often do. Number 8, baby should never be put to sleep with a bottle. This is just not good. It's hazardous because it can cause serious tooth decay as well when babies are older and when they have teeth. So number 9, all babies, whether breastfed or bottle fed, should be offered a feeding whenever they show signs of hunger, and especially if it's been like 3 hours or more since the last feed. Okay, so early signs of hunger include REM, we call it, the rapid eye movement, so the eyes are batting in the sleep when they're closed, or they just woke up, or babies licking their lips. Now late signs or later signs of hunger include rooting, they go like this, or they put the hand to the mouth activity, and of course a very late sign is crying. By now the little one is too worked up and annoyed to focus on feeding and may also greedily latch on too shallow quickly and crack your nipple. So tell me, how is breastfeeding going for you and your little one? Do you have any challenges? Do you like breastfeeding? Comment below, and I'll also make more videos. Just tell me what you'd like to see or what you'd like to learn. So this is Dr. Chris signing off. Ciao.